Let me see how many people joins. Hi, everybody. This is Jorge Gonzalez. I'm the director of TBMed. As you know, TBMed is a business association that promotes digital health, and we are now very much focused into digital transformation. And that's why we have created this series of events, the series of webinars, where we bring top-notch people that are very knowledgeable about digital transformation, and we ask them to share their insights with us. In this case, today, we have Paddy from Damo Consulting. He's going to talk us about why now digital transformation, what is going on in the States, how an organization can start a digital transformation process internally. And without any further delays, I want to thank you again, Paddy, for joining us today. And please, the floor is yours. Just a little bit. If you have any questions, please mouse over in the bottom part of your screen and access the Q&A part of Zoom. Please put your questions there, and Paddy will go through them once the presentation is over. Okay, thank you very much. Paddy, all yours.
Thank you very much, Jorge, and it's very kind of you to provide that introduction. And I want to say good morning and good afternoon, good evening to all of the participants on this webinar today. I know we have a truly global audience, and I'm really, really excited to be speaking to you today. So Jorge reached out to me a while back and asked if I would be open to doing a presentation on digital transformation in healthcare and why now. And this is a question that for some of us may feel like, it's no longer a question of why, it's a question of how quickly. And for others who are in early stages, it may still be a pertinent question. Regardless, what I'm going to do today is talk about the current state of digital transformation in the US healthcare system and how that might be pertinent and how that might translate into other parts of the world. I'm also going to be taking some of the content and themes from my recent book, Healthcare Digital Transformation, How Technology, Consumerism, Technology, and Pandemic Are Accelerating the Future. So I think we're going to go for about 20 minutes or so, and after that, we'll open it up for questions. Very briefly about my firm, Damo Consulting. We serve healthcare enterprises and the technology vendor community that serves these healthcare enterprises. So we are exclusively focused on healthcare as a company, and most of our work is with big hospitals and health systems in the United States. And the work that we do for them is digital transformation strategy, advisory, technology strategy, technology partner selection, and we bring a lot of deep proprietary research and insights into our work. We also do a lot of growth strategy work for technology firms that are looking to serve their clients better and looking to grow in the healthcare market. So we are essentially an advisory firm. We've been around since 2014. I started the company after my time in two healthcare analytics startups that went through successful exits. And I started my firm, Damo Consulting, in 2014. I've been running it full time since then. You can see a little bit of my background over on the right. And on the left, you'll see my two books. So my first book was called The Big Unlock. The Big Unlock was a book about data and analytics and how that is going to drive transformation in healthcare. And I also host a podcast by the same name. My more recent book, which you see over here as well, is Healthcare Digital Transformation, How Consumerism, Technology, and Pandemic Are Accelerating the Future. I co-authored this book with Ed Marks, who is the former CIO of the Cleveland Clinic, which is one of the top hospitals in the United States and a very well-known brand internationally. Actually, the book, the themes and the content for the book came out of the work that I and Ed did together while we developed the enterprise digital transformation strategy for the Cleveland Clinic. And I'll tell you a little bit of a backstory as well. We had completed the manuscript and handed it to our publishers in February of 2020. And then the pandemic struck. So we decided to hold off on the publication of the book so that we could go back and do some more research on the impact of the pandemic. And we had assumed that the pandemic was going to slow down investments in digital health and digital transformation. Well, what we found was the exact opposite. We found that investments had accelerated, and the entire pace of digital transformation had accelerated across the board, especially for telehealth and virtual care models. So we rewrote several chapters in the book and gave it a new title. The original title for the book was something else. We rewrote the book and the title and released it in August. And so that's a little bit of backstory on the book. I want to share a little bit about me personally. We tend to talk a lot about the technology and the business, but we're also people and we're also humans with passions and interests. My passion is music. And during the pandemic months in 2020, throughout the late spring and summer, I did a series of concerts. I'm a musician. I play guitar and I sing, and that's me over on the right. I look a little different in that picture, but trust me, that is me. And that was on my driveway at my home in Chicago, where I live. And I did a series of concerts for my neighbors, and you can see some of the pictures over there on the left. And every other Saturday, I'd go out on my driveway and perform for a couple of hours for my neighbors. And they would come, they'd sit around, socially distanced, of course, enjoy a little bit of music and get a little bit of relief from the lockdown and all of the stay at home and all of the other pressures that they were going through. So it really did a little bit for improving the emotional health of the community. And so I felt really good about doing that, and I wanted to share that with you. Okay, so let's talk about the impact of COVID-19. We are now past COVID-19, and we're in the vaccination stage across most of the world, but COVID-19 hasn't gone away. What we've seen is that during the early months of the pandemic, many health systems had implemented some kind of a telehealth solution, but they were not really getting a lot of adoption or traction with it. And there were several health systems that had not even implemented telehealth solutions. So all of them had to either put a telehealth platform in place in a very short time, and those that had it had to scale it up very, very rapidly in a very short time. Now, telehealth is a norm. Of course, a lot of visits have started going back to the hospitals, but telehealth is still a very, very important part of how care is delivered in healthcare in the United States today. But now health systems must look beyond COVID-19 to develop and implement long-term digital transformation roadmaps. Digital leaders have to implement their roadmaps in line with the strategic priorities for the enterprise, and CIOs, for their part, have to transform IT to support digital transformation. And finally, what we're seeing here in the United States is that technology decisions must deliver enterprise-level impact instead of serving just departmental priorities. So that's a significant change in the mindset of organizations that are trying to drive digital today. And we're seeing a lot of acceleration in many aspects of digital transformation. And I'll talk about some of that in a bit. There's one other very important development that is taking place in the United States. Non-traditional players are moving aggressively into healthcare. And what do I mean by non-traditional players? I'm talking about companies like Walgreens or CVS or Walmart that are traditionally not considered healthcare providers, but they are moving aggressively into the healthcare space. We're also seeing that a lot of technology firms, both startups and big tech firms, are getting deeper into the healthcare space. For instance, Amazon has announced that they are going to launch Amazon Care, which is a virtual care service that's going to be available in all 50 states in the United States starting May. So they're going to be actually getting into the business of healthcare services. And we used to think that technology firms will essentially provide the technology to enable digital transformation. But what we're seeing now is that they're actually now getting into the business of healthcare. So for health systems, for traditional hospitals and health systems, the fact that non-traditional players are moving aggressively into healthcare is a compelling reason to act and to accelerate their own business transformations. We did a survey recently in partnership with Chime, which is an industry organization whose members are CIOs of health systems. So they serve healthcare enterprises, and specifically health systems. So we did a survey in Q1 of this year with Chime, and we asked a number of questions. I'm going to share some of the results from the survey. This chart here answers the question of what digital patient engagement initiatives the organization is currently focused on. And why do we talk about patient engagement? Because at a very core level, digital transformation is really about transforming the patient experience. There's also other aspects to digital transformation. It pertains to transforming your internal operations, transforming the provider experience, and so on. But for the most part, we are referring to transforming the healthcare experience for patients. So we asked our respondents, what initiatives are you currently focused on? You can see the responses here. The number one priority is real-time virtual consults. That means telehealth. And that could be essentially what we refer to now as virtual video consults. And those video consults will include consults between doctors and patients, and also between doctors and doctors. There are other enablers that are considered equally important. Appointment scheduling, because now patients have the ability to do video consults, they also need the ability to be able to schedule their visits online using self-service tools, get automated reminders and notifications, other forms of communication related to their ongoing care management, and other self-service tools. And we have done entire mappings of patient journeys to see what are the different digital engagement touch points that are high impact and high value. And we have seen over 100 different engagement touch points that health systems are implementing today, but about 30 of them are very high value. So those include things like digital education, telehealth, symptom triaging, chatbot features, online registration, online scheduling, online doctor finders, symptom checker tools, payment gateways, and so on. There's a number of them. And you can see one of the quotes is very important to see, focus on tools for patient engagement, portals, self-scheduling, communications, billing estimates, payment arrangements. All of this is now moving online, and that is really what is driving digital transformation today. We also asked the question to our respondents, how do you budget and how do you fund all this? And for those of you who are familiar with the US healthcare system, most of healthcare today is funded through what is known as a fee-for-service model. And unlike in other countries, especially Europe, we don't have universal healthcare. What we have is private sector healthcare for the most part. There is, of course, a big government component to healthcare, but a very big part of healthcare is private sector driven. And so hospitals and their insurance companies usually get into arrangements where hospitals are reimbursed for any service that they provide. And this payment model is known as a fee-for-service model. So if you're a patient and you come in for a routine visit, the doctor will get reimbursed for that routine visit by an hourly rate. If you come in for a lab test, you'll get the hospital will get reimbursed at a certain rate, and so on. And there are literally thousands and thousands of codes attached to how you get reimbursed. And this is known as a fee-for-service model. In a fee-for-service model, therefore, you have to really make sure that whatever investments you make, you can recover it through the fees that you're paying. And that becomes a big challenge in digital transformation, although a lot of that is changing because now people are finding alternate ways to structure these contracts so that they can invest in the technology and benefit from the gains coming from the technology. More importantly, the market needs it and the market expects it. And the market is always going to be the final arbiter on what gets done by the service providers. So we asked the question, how do you fund your digital initiatives? And the answer we got was that half of our respondents said, we don't have a separate digital budget. It's all part of IT budgets. What it goes to show is that CIOs are driving digital transformation in health systems, and most of the investments are now being folded in under the overall umbrella of the IT budget for the organization. But there are differences. On the far right, you see that there are some health systems, and these are the leading health systems. They have separately allocated budgets for implementing initiatives, and then you have others in between. But for the most part, a lot of the technology investments that go into digital transformation are funded out of IT budgets today, although that is changing. At Damo Consulting, we developed a 4-stage maturity model to help health systems understand how mature they are in their digital transformation efforts. And in this 4-stage model, in model 1, in the United States at least, model 1 is where health systems rely almost exclusively on their electronic health record platform vendors, such as Epic and Cerner, for driving digital initiatives. And for those of you who know, the United States went through a massive medical record digitization effort over the last 10 years, and electronic health record systems have now been installed and implemented in almost 100% of all healthcare organizations today, whether it is clinics, whether it is big hospitals. And now we are trying to graduate from simply digitizing records into driving digital transformation and completely transforming the way we deliver healthcare in future. But for that, you need a whole new set of tools in addition to electronic health records. This is where Model 2 entities look beyond EHR platforms and they look at standalone tools for either telehealth or digital front doors, which is what I talked about earlier, which is all of the patient engagement initiatives, remote monitoring programs, whether it is for chronic care or for post-acute care, patient communications. Very important component of digital transformation is being able to communicate synchronously and asynchronously with patients using devices that they already have and using secure communication tools. Model 3 is where these health systems go one step further and appoint a full-time chief digital officer or executives, but typically they're focused on patient-facing initiatives. Model 4, which are the most mature enterprises in our model, they are the ones that are looking at transforming their enterprises in a very, very holistic way, not just at the front end, but also at the back end. So typically they'll have a comprehensive enterprise level strategy with a board level budget and a dedicated senior leader. They will have typically 1 or 2 strategic technology partnerships in addition to the EHR platform. So these partnerships could be cloud-based partnerships. It could be CRM partnerships, customer relationship management. It could be 1 or 2 others, maybe in the area of analytics. But these are considered strategic for driving digital transformation. And last but not least, there is a big and growing ecosystem of digital health innovation. And a number of digital health startups have come up with very innovative solutions that are now being deployed in driving transformation. And with many of these startups, there are certain risks involved. And the biggest health systems have robust internal governance processes to evaluate the startups, to onboard them, and to manage the risks. And this framework is something that I'm going to come to because this is what really is the foundation for understanding where you are with your digital maturity and where you can go from there. So we've taken that and turned that into a scoring model, and the scoring model Many health systems have taken the assessment. The assessment provides you with this kind of a chart where you can measure your maturity in terms of the strength of vision and the strength of execution. So if you look at this, provider 5 here is very strong on vision and on execution. Provider 8, for instance, is very strong on execution. They've implemented a number of initiatives, but they don't necessarily have an overarching, comprehensive enterprise strategy. And you can look at the rest of this and get a sense. Now, if one of your organizations wants to do the assessment with us, we will conduct the assessment and put your organization on this map along these two dimensions, and you'll know where you stand. We provide additional detail as well. When we look at health systems across the board, we look at what they're doing in terms of implementing. What are the high priority use cases for digital transformation? And we look at digital front doors. So from this table, for instance, and this is a sample of 8 different health systems that have taken our maturity assessment, you can see that everybody has implemented online scheduling. Everybody has implemented online check-in. If you go further down, almost nobody has implemented second opinion. And when it comes to other initiatives, find a doctor, everybody has implemented that tool. When it comes to other solutions like online registration or wait time estimator or slot management, it's a mixed bag. If you look at provider 5 as an example, you'll see that they've implemented almost all of the high value initiatives that we've listed on the left here. So they are very, very mature and very advanced. But if you look at provider 2, you'll find that they have implemented only a handful of these high value initiatives. If they happen to be operating in the same markets, provider 2 is going to be at a disadvantage compared to provider 5, because provider 5 is now able to serve the emerging needs of consumers as it relates to online engagement and online delivery of care. And so this is how we get the conversation started about where your digital maturity and where you should go, depending on what your corporate goals are. This is a framework that is from my book. And for those who are listening to this presentation going, okay, where do we start as an organization? This is a framework to get you started. We look at digital transformation as a 3-phase journey. In phase 1, you really have to start with laying out the digital strategy and the enterprise vision. And that means understanding really where digital transformation fits in your overall strategy, what are the goals and objectives, and importantly, what are the risks of not executing a digital transformation? The risks are very clear. In healthcare, if you're not executing a digital transformation program, you're going to fall behind and your entire existence and survival could be at stake. And the next step you go is to really do a readiness assessment. How ready am I in terms of my internal resources, my budgets, my leadership bandwidth, and so on, and overall board level support to really drive transformation. Once you've gotten the answer to all that, you move forward quickly, you develop a digital roadmap, you prioritize the initiatives, put together a budget, get board approvals, and start executing. And when you start executing, you have to have an operating model which lays out how you're going to structure yourself internally as an organization to drive initiatives. And then, of course, you have to go out and select technology partners. You start with the technology partners that you already have, but you will find that you may need to go out and bring more technology partners on board. This framework, I've described this framework in great detail in my book. For those of you who have had an opportunity to get a copy of it, you would have seen it. Or if you're interested in buying one, you can always go in and look at it. But there's a lot of detail behind this. And this is just the starting point for those who are looking at digital transformation and going, where do I start? How do I execute it? What can I get out of it? This is a framework to start thinking around that. I'm going to stop with that because I want to set aside time for questions. I just want to share that there's a lot of additional content and information on my website. I invite you to subscribe to my newsletter, my weekly newsletter on digital transformation. I invite you to subscribe to my podcast. It's a valuable resource because in my podcast, my guests are all chief digital officers and chief information officers, they talk about their journey. So if you want to hear it directly from the practitioners, other health systems, other healthcare organizations, on how they're executing digital, I would strongly recommend listening to some of those podcast episodes. And then, of course, I participate in a number of events, and we publish a lot of research and white papers in my firm. You can get it all from my website. Most of them are complimentary reports. Okay. With that, I am going to end the presentation and open it up for questions. You have my contact information here. So if anyone is interested in reaching out to me, you're welcome to write to me directly. I invite you to visit my website as well. And I invite you to you can also buy copies of my book from my website. In fact, I offer signed copies of my book for anyone who orders it on the website. So anyway, with that, I am going to conclude the presentation and open it up for questions.
Thank you very much, Paddy. We already have a question from Carlos. He says that in his opinion, it makes a lot of sense to have real-time virtual consultations, but he wonders about the organizational internal processes. And he asks you, how do you see managers in terms of trying to do a digital transformation regarding internal processes in healthcare organizations?
Yeah. So, someone told me this: with any transformation projects, 80% of it is about the people, 15% is about the process, and 5% is about the technology. So what that really says goes to the heart of the question that you're asking, Carlos. The technology is available. If you want to implement a telehealth virtual consult platform, the technology is available. Now, to implement the technology, you have to consider a number of things, starting with the fact that you're going to have to change the way you deliver care. So you have to define your processes for setting up and conducting telehealth visits. You have to define security protocols so that you are not compromising the privacy and security of the doctor-patient conversation. You have to take care of a lot of technology aspects, the bandwidth, the devices, and all the enablement at the back end. You have to integrate the platform with backend systems so that you're able to capture the encounters and bill for the services and capture the data so that you can integrate it into patient medical records. This means a lot of work for not just the doctor and the patient, but a lot of work for caregivers, administrators, and the internal technology organization. So it's very, very important to pay attention to that. And we are working with a lot of health systems that sometimes get ahead of themselves and go and implement the technology, and then they find that they were not adequately set up. So you have to start by, I talk about that in my framework where I talk about readiness assessment. Before you launch the program, make sure you're ready for it. Because the pandemic didn't give us that luxury, so people caught up to it. But for the most part, you should be able to plan for it.
Thank you very much, Paddy. There is another question. It's asking for your book, but for payer space. Any ideas?
Well, maybe you're giving me an idea to write a book in payer space. Well, I don't know that, I believe that what we wrote for the provider space was very unique. And that's the reason we wrote the book, actually, Ed and I, because we didn't see it. We were looking for a book that could tell us what are the best practices out there that health systems executives could learn from. And we didn't find that book. So we wrote the book. So maybe, there's somebody out there who is in a similar position to mine, who has deep knowledge of the payer space and is writing the book. I hope so, because when it comes out, I'll be the first one to buy it.
Right. And I have to say that I've read Paddy's book and I really learned a lot. I strongly recommend it because it's very insightful and very easy to read, both in the same book. So very, very good investment. Paddy, I want to put you with a situation that I came across the other day, where I've been trying to support. It is not an organization, okay? It's a group, it's a department in here in Spain, and the leader wanted to implement a kind of digital transformation, taking leverage. Now there is a Next Generation Europe funding program for the recovery after COVID. And some people didn't want to go for it. I don't have clear the reasons. I don't go into the details. But if you were that leader in that group, what would you do? What would you recommend that person to do in order
So,
to push? And remember, we are in public. We cannot fire people. Okay, we are in public administration here in Spain. We cannot fire the people that they are not aligned with the strategy or with the vision. It has to be something different.
so if I understand your question right, uh, there is resistance to implementing digital programs. Is
Yeah,
that
to launch now. There is an opportunity to change the way that things are and that healthcare is delivered,
yeah.
because there is going to be funding available to incorporate digital solutions and digital transformation process. I mean, not only the technology but also the capacitation around the technology, and that the head of that unit wanted to go for it, wanted to propose a project to take advantage of that funding program.
Yeah.
But some of their say second level or second level people in the unit, they show a lot of resistance for doing that, because basically from what I heard in that meeting, too much work, uncertainties, human nature at the end of the day.
Yeah. Well, this is no different from any kind of transformational initiative. And human nature, part of human nature is to resist change. So not knowing the specifics of the situation, but the broad issue here seems to be one that is very common to many transformation programs: resistance to change. So you really have to find your champion. There must be, not everybody is going to resist the change. There will be at least one or two people who are willing to make the change, who are going to be champions for you, and who see an opportunity to transform their careers and to transform the lives of patients and caregivers around themselves. And then, I would say, work with them, find projects or find initiatives that have the greatest common benefit, and that can be accomplished with not a lot of resources, but can also deliver impact in a short time. We actually use a prioritization matrix when we talk to our clients, because they have the same problem, and they have 30 initiatives that they want to implement, and they don't have the money for all 30 initiatives. And then there's always internal struggles about which one gets priority and which doesn't. And then, of course, the board is asking, okay, when are we going to see the returns? So you have to triangulate all this, and first of all, find the one or two champions in your team who will go along with you. Work with them and work with your broad group of users, right? Stakeholders outside of your organizations who are going to benefit from your programs, and pick the one or two projects where you think you can deliver significant impact in a relatively short time with relatively less investment. And once people see the benefits, then other things will start moving. You can't wait for a crisis. The pandemic actually forced health systems to adopt telehealth. And this happened at a time when telehealth was coming along very slowly, actually. And there was a lot of resistance to telehealth adoption for a variety of reasons, but the pandemic forced it upon them. So if you want to avoid the next, avoid getting stuck in a similar situation with the next pandemic, you have to prepare for it. That may be one message to deliver. Again, not knowing the specifics, I wouldn't be able to tell you.
No, it's enough. It's very good advice, buddy. Actually, I want to put to you another scenario question, which is, say that now you are a believer. You work, say in Spain, we call it central services of a regional healthcare provider. So you are not the CEO, you are not the manager, but you are close to that, and you truly believe in digital transformation. But you need the top management to give you permission to start the ball rolling. What will be your actions? What would you suggest to that guy, that person?
My advice to that person would be to persevere. If you have a good idea and if your patients are going to benefit, my guess is your superiors will listen to you. And then you'll have to work through, how do you actually bring it to life? How are you going to pay for it? How are you going to get organizational resources to support the program? But all of that has to start with the end customer. Is it something the customer is asking for? Is it something that is going to make life better for the customer, deliver a better experience? If the answer is yes, then you should absolutely, persevere and evangelize it with your superiors and take the opportunity to write it up and share it with your colleagues, get their feedback, and then proceed that way. Because I can't imagine that if your customers, any organization, if your customer is asking for something, I can't imagine why anyone would say, no, we won't do it.
Right. Then about the I'm curious to know about the organizations that are in model number 4 that you mentioned before. Where are they heading to? I mean, you have mentioned in that other table, that second opinion, there were some gaps, but in general terms, I mean, if you understand that like a kind of a flow or a funnel, where are they heading to in their next endeavors now that they are in level 4? How is life in level 4, so to say? I don't know.
Well, first of all, these organizations are they've put in a lot of time and effort and resources to get into level 4, and they're currently executing on that vision, right? And they're pushing the boundaries, and they're looking for better ways to serve their customers. And a lot of these programs are still in flight. They're not fully executed. And healthcare is relatively has been relatively slow in adopting digital transformation compared to other sectors like e-commerce or banking or securities or other sectors. So even the model 4 organizations, for them too, it is currently work in progress. And they are making sure that they're optimizing it, stabilizing it, and making sure that they're able to deliver the better experiences and outcomes that was expected, and delivering a return on the investment. What are they going to do next? I think what they're going to do next is they're going to benchmark themselves against the best in class in other industries. That's what they're going to do. So being the best in healthcare is no longer enough. You've got to be best, period. So the leading organizations that are in model 4, they're going to look around, they're going to look at what e-commerce is doing, what retailing is doing, what hospitality is doing, or personal finance is doing. And they're going to bring people in from those kinds of industries to transform the way care is delivered. Why is that going to happen? Because already you've got people like Amazon getting into the healthcare business, and they're bringing the best practices that they've learned from the e-commerce business in serving patients and customers. And so unless you are able to match up to those benchmarks, you're going to struggle. So that's where they're going to go.
So I guess that patient engagement and patient experience is going to be key for that. But beyond that, can you see other areas that will be kind of priority for level 4 organizations?
Yeah. I think patient experience. So there's an important difference between healthcare and other sectors. In healthcare, it's not enough to just focus on the experience for the patients or the consumers. It is equally important to focus on the experience for the provider or the caregiver. So the doctors, the nurses, and everyone else that is involved in delivering care, it is extremely important that their experience is also addressed as a part of digital transformation. So giving them better collaboration tools, giving them better data analytics and insights for them to be able to do their jobs better. All of these are going to be extremely important, because you cannot deliver better patient experience at the expense of the doctor's experience. Right. So that's going to be one important part of how organizations are going to improve their efficiencies and productivity and deliver better care and better experience for patients. There are other things, on the supply chain side. And one of the big things that came out recently was that because of the pandemic, we realized how vulnerable the United States medical supply chain is. And there was an overdependency on China and Southeast Asia. And so all of that means that you now have to transform the way you manage the back end of your organization in order to ensure that you have better experiences with patients. So all of that, the big organizations are focusing on all aspects of it. But if there was one thing you asked me, I would say it's the provider experience in addition to patient experience.
Right. Experience. Okay, I'm writing this down. Oh, I had a question and I just forgot. It was regarding, culture. Culture is something that is mentioned a lot in digital transformation. And you know the famous phrase, culture is a strategy for breakfast. Can you tell us something more about how to create the right culture within healthcare with the support of digital?
Well, when it comes to any kind of transformation, the culture aspect of it is first and foremost, because what you have to do is make sure that you have created the conditions for people to be successful,
Right.
while at the same time ensuring that your customers are benefiting. And so it's got to be a culture that supports innovation. It's got to be a culture that supports experimentation. It's got to be a culture that supports empowerment at the front lines of care. It's got to be a culture that encourages the use of digital tools and technologies and invests in training people for the next phases of the transformation. So all of that, and I couldn't tell you that one is more important than the other, but these are all the attributes of organizations that do the transformation successfully, based on what I've seen. There are lots of organizations that are resisting it, that don't want to change, that don't want to, think about anything beyond EHR, that don't have the internal ability. And first and foremost, it has to start at the top. The tone for all of this is set at the very, very top of the organization, and then it flows down to the rest of the organization.
And any kind of, I don't know how to say, action tactics, initiatives that that you think that work, kind of best practices that in terms of this culture building?
Yeah, I would say if there is one thing that I would say is important in ensuring that the right culture is instituted for driving digital transformation, that thing would be that the CEO of the organization is seen to be invested in the transformation, supportive of the transformation, and is involved hands-on in the transformation program. Okay. That is more important than anything else. And of course, along with that, there has to be a group of senior leaders. See, digital transformation is not something you delegate to somebody 3 levels down in the organization from the CEO. It's got to be owned by the CEO, and it's got to be driven by somebody for whom it's a full-time job and who reports up directly to the CEO of the organization. And this will send the right messages to the organization. If not, if it's seen as a part-time job for somebody who is 3 levels down in the organization, you will not be able to build the culture that you need for transforming quickly. You will not be able to do
that. I completely agree with this, Paddy, in my opinion, because we from TPMA, we come from the innovation area, and we think that that's a particular opinion. Obviously, innovation can be more bottom-up than digital transformation. You can have pockets of innovation in different departments, not necessarily coming from the top. But I completely agree with you. I mean, digital transformation is a top-down initiative that has to start in the top. And if you don't have this leverage on the top, you better wait, because it's not going to work. I don't know if you agree with this. But
Yep.
Okay. Regarding and again, please put your questions in Zoom. Otherwise, I could spend the whole day talking with Paddy. But I think it's will be very relevant to have also your own questions and get solved. by Paddy. Regarding the process and the change management, and who should lead this kind of initiative? Of course, the CEO has to be the endorsement, has to have very clear role, but it's always this discussion about it should be the CIO or the TDO, digital Chief Transformation Officer. I see that in the book you mentioned that depends on the organization, but say what will be your ideal model? I mean, there are at least 3 models that you show in the book. I don't know if you please explain them, but in the ideal world, if you were having to start from scratch, what would you do?
It's a very good question. So as you mentioned, Jorge, in my book, I've talked about broadly the 3 models that we come across in the market, and this is. Let me start by saying that in US healthcare, the org model for digital governance is evolving. Today, I would say that in the majority of the cases, digital transformation is led by the CIO of the organization. However, if you look at the top healthcare organizations in the country, the top 25 or 30, they have a slightly different approach. Typically, in these organizations, there is a dedicated chief digital officer in addition to the CIO. And these organizations may also have other executives who are responsible for aspects of digital transformation. It could be a chief innovation officer, as an example. And we're also seeing that in some organizations, it's a committee of senior leaders that collectively makes the decisions. But one thing you will find if you look at the top layer of health systems in the United States, they will typically have a full-time chief digital officer. And it's important to understand what the role of this individual is and what he or she owns and doesn't. So typically in these organizations, the chief digital officer may own certain components of the overall digital program, but other programs are owned by different groups. And the chief digital officer is an enabler, a facilitator, somebody who governs the digital program, somebody who helps to secure the budgets, prioritize the initiatives, and lays down a set of governance principles for driving the digital programs, especially programs that have a lot of interdependencies with other programs. So the role of the chief digital officer, the way it is defined, varies from organization to organization. It also varies in terms of the background of the individual. There's a wide range of backgrounds. In some cases, the digital function is led by a clinician. In some cases, it's led by the head of IT. In other cases, it's led by somebody who is new to the industry, who has been brought in from another industry, like retail, because they have a better understanding of how to improve consumer experiences, right? So the answer, I don't have an answer for your specific organization. It depends upon where you are in your maturity. If you're in model 1, I would say, look, whatever you're doing, stay with it for now. Let the CIO drive the initiatives and continue to make the most of it. But if you're in model 4, then you have a very different set of variables that you're dealing with, and potentially a broader mandate and more resources also to execute on your vision. So it depends on where you are in the maturity model. It depends upon what kind of an organization you are. But what I've just told you is what we are seeing in the market.
Right. I understand. But in terms of more at the global level, at the ecosystem level, so to say, apart from what everybody is doing and it has been done, like you writing the book and giving consultancy, we, for example, we try to deliver value by organizing these webinars, providing also capacitation. What do you think, what kind of actions do you think could be put in place so that the process, this digital transformation in healthcare gets somehow accelerated for good? Okay, we understand that, but what do you think that is missing? What else could be done that maybe perhaps us or someone of in the audience could trigger?
I think what you could do, every single one of us can do this, and that is to the evangelize the importance of digital transformation, and take your best practices, take your success stories, and spread the word. Write a blog about it. Participate in a webinar. Listen to podcasts. Share content with your colleagues that you think is relevant and pertinent for the work. We do this and we practice this within my organization. The reason I do the podcast is because it is a platform where senior executives come in and share their experiences. And I want others to learn and benefit from the experience. It's not for us, it's not just for me. I learn from it, of course, but I use the podcast as a platform that others can learn from. Similarly, that's the reason I wrote the book as well, because we believe, both Ed and I believe very strongly in the transformative potential of digital. And we also felt very strongly that unless healthcare organizations embrace digital and accelerate their digital transformation journeys, they are going to have a survival issue on their hands. So spread the word, participate, build your community, share your best practices, read as much as you can, listen to the podcast, do all of that, attend conferences, write and speak if you can at forums where you have the opportunity. And that way we build the community, we build momentum, and we evangelize the cause of digital. And that is what I think is going to really make a difference in the long term.
Right. I completely agree, Paddy. Regarding the content that you think that it works best, you have mentioned a lot of it. Is that success stories the ones that you think that drives the most attention, or what kind of content you think is more appealing for?
Yeah,
obviously for the audience that can make things, which at the end of the day are the engines of change.
Well, the content can be of two kinds. Content can be individual stories, how a certain organization implemented a certain type of a program, and what were the learnings from the program, and what were the challenges, and all of that. The other is a more universal kind of best practices, knowledge sharing, if you will. What are some of the what are some of the trends that we see in the market? We just had this conversation about what is the best organization model for driving digital transformation? Should it be CIO? Should it be CDO? Should it be somebody else? Well, if you read the research that is out there, and there's a lot of research being published all the time, that research is also valuable. Why do we do the annual survey? I just shared the annual survey results as a part of this presentation. We do the annual survey because we want to know year after year, how are things changing? What is priority for this year? So I think the research is also great content, especially if it's original research and shares new insights into what is going on here and now. And people want to know what's happening here and now. They want to learn from what has happened, but they also want to know what is happening now and what they should anticipate in the next 6 months, 12 months, how that might change their work, how that might change the prospects for their organization. So try to absorb as much of it as you can. There's a wide range of sources of content out there, and we are a small part of it, and we are trying to make as much of an impact as we can at our level. But there is 1,000 others like us, and they're also doing the same thing. And take whatever is relevant for you. Take the best and move forward.
Fantastic. I have to say that with this, we are about to close the conversation. Is that today I think that we have one speaker that can tell us about the best practices and trends, that is like you, and also brings original research as presented in your slide. Next week, we are going to have a Humber River, which is a Canadian hospital. I don't know you're aware of it, if you knew it before, Paddy, that we have been told that they are doing a very good job in digital transformation, and we want to have their individual story. They want to know firsthand how they did it and what are the challenges that they have and how they did overcome them. So we we from next Thursday we will start at 5 p.m. in Central European time, and next one is going to be Humber River, and again it's going to be open and free. And with this, I want to come back to you, Paddy, and really thank you for your insights. I think I'm taking some few takeaways, well, the stress on people. This is what we always say, but it's very good that someone like you stresses that digital transformation is not about artificial intelligence, 3D printing, Google Glasses. It's not about that. It's about change, about how you empower people. The showing that there are examples of level 4 companies, I think is very relevant, because it gives some kind of hope that this is possible, and if others can have been able to do it, then it's possible to do it. And yes, I mean, about the culture, about the CEOs, the leadership really being leaders at the end of the day, not just chief executive officers, but really leading by example in their organization, is one of the best ways to create a new culture, to change the culture. And of course, it is all in all our responsibility to evangelize and to help to spread the good things about digital transformation, and to encourage others to follow it. Paddy, thank you very much.
Thank you. I greatly appreciate it. Thank you, everyone.
Pleasure to have you. I don't know if you want to give anything. Do you want to say anything, Paddy? Just
no, I just want to say thank you for the opportunity, Jorge, and to TC Biomed for inviting me to speak to your audience. And if you want to learn more about my work, my firm, you can find me on LinkedIn. You can go to my website, and I think Jorge will be.
Yeah, in the chat we have put your contact, Paddy, and of course anybody can contact us as well to get in contact with you. But it is we publish your presentation online as well as this recording, so I'm sure that whoever is interested can reach you, and if not, we can help them to reach you. And again, thank you very much, everybody, for attending. And next week we have another episode with the Humber River from Canada. Thanks to all. Bye.